Hi, welcome to my YouTube channel. My name is Noel. I'm a psychotherapist and counsellor, and this is a very short video to look at the question, what is counselling and psychotherapy, and some idea of what it might offer for you should you choose to get hold of me. The first thing to say is counselling and psychotherapy are the same thing in general, they're just spelt differently. So don't get hung up on the words, they don't really mean anything. They're sort of the same thing. So what can you expect? Well, in counselling or in psychotherapy, it's a process where as an individual you can come and take some difficult things, some difficult issues, feelings, emotions, relationships, and you can express those difficulties or indeed discover what they are. You may be confused about something in the process, in the work, in the relationship with the counsellor. Um, Depending on what the problem is, there are a number of different types of approaches because there are a number of different forms of counselling and psychotherapy. It's not all the same stuff. So different forms of therapy, different forms of counselling will work with different problems. So if the problems, the difficulties you're having are about depression or anxiety, then cognitive behavioural work, which is a form of therapy, is useful initially. If there's trauma issues, again, some cognitive behavioural work, but if it was the childhood stuff, we may look at having to rebuild trust around the failure of the adults in your life to care for you. And then we would get into a much more sort of psychodynamic, as they call, relationship. So looking at early childhood, I act in role, as it were, as the new parent that will help you change your relationship to your inner child, the good parent. There's creative therapies, which I offer, drama therapy, which helps you with practical skills, rehearsal skills, trying out different roles, emotional reality, all that sort of stuff. So it really depends on what the issues are. If there's addiction issues, I can help you with that. One of the most successful forms of addiction therapy is called 12-step facilitation therapy. There's lots of evidence for that having worked. So depending on what the painful or the difficult issues are, we would find together what the best form of therapy or counselling is, and generally how long that is going to take. We've set up some goals around that. But the process in general, whatever it is, whatever the issue, whatever the form of therapy chosen, the process in general is focused on enhancing your sort of psychological and emotional well-being, and with the ultimate aim of you achieving your full potential in your life. So that's the goal, really, for you to become more fully you and more effective in your life. So it should help you get a better understanding, or it will, if you work with me, help you get a better understanding of the types of skills you might need to deal with situations. So you may need to learn new skills if you have problems with anxiety. Maybe those skills are around meditation or relaxation. You may need to learn new interpersonal skills if your problem is codependency, for example. You may need to learn new skills around being able to assert yourself appropriately in difficult situations. Or if it's addiction, we look at relapse prevention skills, so recognising your triggers and not getting caught up in them, not getting hooked into them, and being able to get out of situations and ask for help. If you're recovering from addiction, learning to ask for help is a new skill often for people. So looking at the new skills that you might need to develop, and you can try them out in the therapy with me. So have a go at them, practice them, go and try them in the real world, come back, discuss what that was like. So you're getting the idea it's very much a collaborative process. We're both involved. And then you develop a unique relationship here. It's a unique confidential relationship, so nothing that happens here is going to go to the other people in your life. There are limits to confidentiality. If you're thinking of hurting yourself, if you're very ill, or if you're thinking of hurting somebody else, we would discuss that, how real that is. and if you need help so that you're not going to hurt yourself. Or if you're thinking of hurting children, there might be limits on the confidentiality there. I may need to bring in other people to help protect the children, for example. Those are extreme circumstances, but it's well worth knowing. So that my role really is as a facilitator to help you understand your behaviours, your relationships, your feelings, the types of situations, the repetitive often situations that you may have found yourself in, which you found difficult. I will act as a facilitator to help you understand that, get new insights into it so you can understand it differently, and also practice new ways of being around those issues. So that's a role. It's not really to tell you how to live your life, but it's to enable you and support you. And then give you very practical skills as well. So, like I say, if the issues are around anxiety, I would give you practical skills to reduce your anxiety levels so that you're not having the panic attacks, you're not feeling fearful all the time. Similarly with depression, I'd give you practical skills so that you're not feeling bad, that you move beyond that, and you can manage those symptoms much more effectively. It will be a safe space, confidential, as I've mentioned, but also crucially non-judgmental. I'm not here to tell you you're good or bad. I'm here to accept you and value you as a person and support you in becoming more effective. My experience is that telling people off and telling them bad or wrong doesn't work in terms of making things improve. Supporting, being non-judgmental, those are the things that work. And being kind and caring, positive regard, having positive regard for somebody. And I do have respect for people who choose to work with their issues. I've done my own personal work. I appreciate that it can be a challenge, it can be difficult, it can be frightening. So I come as a fellow traveller in that one. So I will help you think about the issues, think about how you might resolve the issues in your life, how you're going to come to decisions about them, whatever those issues are. The decision-making process is very important. And then explore your personal resources and your skills base for that, and increase both of those, both the emotional resources and the skills base. So in summary, it can be very helpful for people. It can be very helpful for you to engage in this new space with somebody like myself who doesn't have a personal investment in your life. I've got no axe to grind. I'm here to help you. It's a professional relationship. And therefore you can have expectations of the relationship, of the work, that you wouldn't be able to have of a friend, for example. You know, you can expect me to have a certain level of qualification, which I do. I'm a postgraduate. Skills and qualifications and confidentiality. Because in the end, you're paying for it. It's a service. So there's a different type of relationship to it. So if you think you might need help with therapy, the sorts of things I can help with, I've outlined, but I'll say again, anxiety, depression, relationship issues, I work with couples as well as individuals, addiction issues, codependency, any trauma issues, some you may have acquired as an adult if you worked in the armed services, for example, post-trauma, or they may have happened as a child. Those are the range of things that I can help you with a range of different types of therapies. So please do get in touch if you feel I can be of help. My number is 07506 319 745. That's 07506 319 745. Thank you for dropping by today. Bye-bye.